Okay, I think we will get going. Hi to everyone who's joining in the chat. So my name is Abby. Welcome to this Step into the NHS session. This is our Career Spotlight 2. Maybe you were in with our sessions earlier on today. Welcome back if you were. Maybe this is your first session that you've been able to join today. A big welcome to you as well. We are really, really delighted that you're joining us, and we hope that you find the session exciting, inspiring, interesting, and all the good things. So we're going to be hearing from Naman and Takanayi shortly, but we've just got some housekeeping bits to do first. So we are recording this session. If you've got any problems with sound at all, then just check your speakers are turned up. But the other thing that sometimes works is leaving the Teams call and rejoining, and that often fixes any sound issues. You are on mute and cameras are off, but the chat is very much open to you, and I can see lots of messages coming in already. Hello from Riverdale Primary. So thank you all for joining us in the Linden Academy as well. Oakdale Junior School, brilliant. So hopefully I can see a few problems with sound, but hopefully you can sort those out. And please do, we'll be asking you to put some things into the chat as we go along. You can use Teams reactions as well if you want to, and we're going to have a great session. So let's introduce this session. This session is called A Day in the Life, and we're going to be hearing from two fantastic NHS professionals, Naman and Takanayi. You're going to be watching videos to find out what they get up to in their day job. And then you'll have the opportunity to ask them your questions. So we want you listening really carefully to what you're hearing, look at what you're seeing as well, and think of some great questions to ask Naman and Takanayi when that bit comes up. Remember, a lot of you might have a worksheet as well. Teachers, these were emailed out. So if you've got a worksheet or even just a bit of paper or a notebook in front of you, jot down the things that you are learning about the roles that you hear about in this session. What sounds interesting? What facts do you want to remember? What do you want to go away and find out a bit more about? Because remember, you might want to use these roles for your entries into the Step into the NHS competition. So I think that is all that I wanted to say. So now we are going to hear from Naman. And he is well, we're going to watch a video actually, and Naman, welcome.
Thank you. Thanks for having me.
Could you just tell us what you do, Naman, before we watch your video?
Yeah, hi everyone. Thanks for the opportunity for being here. I'm a therapeutic radiographer. So we use X-rays to treat people who have different types of cancer or non-cancerous conditions. So we get to use multi-million-pound machinery, which is part of the reason why I applied to do this job. So yeah, lots of things like that. And then I think the skills around talking to people who are going through a really tough time in their life.
Great, thanks, Naman. Okay, so let's hear more about Naman's job, and remember, start to think about the questions you want to ask him.
Hi everyone, my name is Naman Anderson. I'm a therapeutic radiographer at the Royal Marsden NHS Foundation Trust, and I work in research with the Institute of Cancer Research. I also work for a clinical advisor for an amazing charity called Macmillan Cancer Support, as you can see. So in school, I loved problem solving, figuring things out. Today, I get to combine my curiosity, my passion for helping people as a therapeutic radiographer. So I was born and raised in India, and I moved to London when I was around 6 years old. I studied biomedical sciences at university, but to be honest, I just didn't really enjoy it that much. And actually, I wanted a job which was more patient-focused, patient-facing. And actually, it's okay to change if you're not happy with something. So I did a master's degree in radiotherapy and oncology. It was a nice balance between the scientific knowledge and helping people, and using multi-million-pound machinery, which is pretty cool. So there's loads of different paths to becoming a therapeutic radiographer. You can do an undergraduate degree, so straight after sixth form or college, or a master's degree like me, or even an apprenticeship route, which is really, really nice for people. So in the mornings, I typically start with a team meeting, plan the day ahead, discuss what patients we have, who we're seeing, what any issues are. I'll check if I have any meetings, go through some emails, which is a bit boring, but it has to be done. Prioritise tasks and things like that. And then I see patients who have cancer, so check their treatment history, understand their diagnosis, and everything else I need to do to support them. I'll catch up with some specialist colleagues of mine if there's any specific information I need to help me for my patients. but actually quite a few people are going through some very difficult and aggressive treatments, and they may be feeling really unwell, or have some concerns and problems. So actually, I really like to reflect at the end of the day, because obviously sometimes you can take some of these things home, and it's just good to know, if things are overwhelming or there is difficulties, that you can just find help through friends and stuff. So you need to be kind, patient, and honest in this role. Some of the people are going through the toughest times of their lives, and they can be very unwell, and they're living with and beyond cancer. So it's nice to be caring, but have an interest in science, particularly biology. Physics is important, but not essential. Have a strong desire to learn and grow is really crucial for this sort of career in therapeutic radiography, but also teamwork. We don't always work in silos, we work together. It's important to help patients. We work in pairs, sometimes even more. And actually being honest with patients that if something is really going to hurt or the side effects could last a bit longer is really important. I just love helping people, to be honest. And I really like science, medicine, and my career as a therapeutic radiographer, but also working for an amazing charity that help people living with and beyond cancer. Obviously very biased. I love helping people. I like to combine whatever I can. I really hope you're inspired by this sort of career pathway and journey, and I hope I get to talk to you more about it. Thanks.
Oh, that's great to hear, Naman. Thank you. And it sounds such a varied role. You mentioned quite a few skills in there. If you could pull out kind of a top couple of skills that you reckon skills and qualities you use in your job.
Yeah, thank you. I think kindness is probably the main one. So whether we're treating children, adults, elderly adults, as I said in the video, everyone's going through quite a difficult time. And sometimes it's okay for them to be a bit slower than you might expect, or if they want you to repeat things. So sometimes if people are having certain types of treatment, they might struggle with their memory. So it just means that I often will let patients record me, so they can hear it back and share it with their family, friends, relatives, etc. And I don't mind taking a bit longer, which I often get told off for by our nurses, etc. But I think it's worth it for the extra few minutes to really explain things. I think kindness is probably the most important one. But I think also just being honest with patients just about what is going to happen. So obviously we like to be what's called ethical and make sure that patients know absolutely everything, which can mean that they get lots of detail. But I think without being honest about if something's going to hurt or if something's going to be a bit claustrophobic, patients might not trust you as much. And that's probably the biggest aspect. So.
That's a really good point, actually. And you also talked about the kind of more technical side of your job as well. So you've got to have those people skills that you've talked about, the kindness and communication. But it sounds like you also get to use some pretty incredible equipment.
We do. So we get to use, as I keep saying, multi-million-pound machinery. And when you get your training, it's almost like playing a computer game, I guess, moving the machine around, watching the bed move from side to side. And then actually we get to look at all the images. So if you imagine my body, lots of different slices of an image is what you get to see on a screen. So similar to a computer game. And what we do is we look for all the different areas of the body, and we can decide where we want to deliver the treatment. And actually we get to work to millimeter accuracy. So there's not many aspects of medicine that can boast that we get to do that. And that's because of our amazing machinery, images, but also all the different colleagues we get to work with. So I'm very biased. I like the technical side. I think while the people skills are obviously important, having both of those together, there aren't many jobs that lets you do things like that as well.
Brilliant. And you mentioned all the other people that you kind of work with. So one of the things we talk about is the fact that there are so many different types of people working in the NHS, from all sorts of different backgrounds. Does everyone you work with have to have a degree, or do you work with people who might have come in through a different route?
No, you don't. So for anyone living with and beyond cancer, so if they get a cancer diagnosis, they go through a multidisciplinary team meeting. So that will be from an admin manager, so someone who will look after all the data for that person, so all their details, their diagnosis, scans, etc., right up to the consultant who will be the main owner or looking after the treatment plan. So yes, for my role, you sometimes need a degree, either an undergraduate degree or like I did, a master's degree, or you can also do an apprenticeship route. So while you're learning, you're getting paid at the same time, which is quite crucial, I think, for some people. And actually university isn't for everyone, and that's completely fine. And actually there are lots of people who I've worked with who've done an apprenticeship route into the degree, into the role, and then they're able to upgrade it to a degree later on. But you don't have to. The main thing is that you're good with patients, you don't crash the machine too often, and the engineers and physicists love you. That's the main thing. And I suppose you need to have a good stomach for chocolate. So we're very lucky that we get given lots of chocolate by our patients. So when it comes to Christmas time, it's normally one of the clinic rooms is taken up with boxes of chocolate.
That doesn't sound too bad. Great. Okay, so Naman, you can probably see in the chat there have been so many questions coming in for you, so we'll start on those in a minute. But first of all, we have got a question that pupils from Riverdale Primary School have sent in for you, and I think we are going to see that on the slide. That's just coming. So, pupils from Riverdale Primary School, and I know they're here because I've seen that name pop up in the chat. They want to know, what's the best part of your job?
Obviously, I'm very biased that I think that my job is the best job in the NHS as a therapeutic radiographer, but I think it's got to be working with patients. So I think the youngest person that I've treated was 9 months old, and the oldest person I've treated was 102 or 103. So we get a very big range of people that we get to see. But we often see patients, family, etc. from the beginning. So when they're diagnosed right up till post-treatment, and I think you get to know them really well. I think I didn't realize how nosy I was until I got into this job. I want to know about the dog's name, what they do on the weekend, because something that we like to get across is that the person in front of you is a person first. They're not their diagnosis, they're not their condition. So we want to make sure we understand everything. And actually, if we can support in other aspects. So for example, I had a patient last year who was more worried about who was going to look after their dog than actually their treatment. But because we got someone in the community to help look after their dog for treatments, he got through their treatment really, really well. So it's things like that that you don't consider with the people skills that I really like. And I like dogs. So it's nice to be able to help that person as well.
I love that. Great. Okay, so and thank you to Riverdale for that that great question. Right, let's see how we get. We have got 5 minutes, Naman, so let's see how many of these we can get through. You've answered some of them already, I think. I saw one about how you deal with your emotions when you are treating very poorly patients, and that's a great question.
Yeah, very deep question. I think at the start, when I first qualified, I struggled quite a lot because I want to help people. And I think the main thing you have to take away is that while the person in front of you is struggling, if you take it home with you, it's going to really impact you. And it has impacted me before. So I think now being able to talk to friends, colleagues, my wife, things like that, that's what it really is about. So as I said, we don't work in silos, we work in a team. We all bounce ideas off each other. Anyone who works in public service, especially NHS, we love a bit of dark humour. And I think any kind of humour is really important. So having worked through the pandemic where I was basically on call 24/7 for a year, it's quite challenging, but it's the pressure from it that you kind of learn and you take forward as you grow and become more mature, and then you get more resilient. And actually, you know how to handle those situations a lot better next time. But it goes back to being honest with yourself as well. If you are struggling, you need to reach out. I'm quite openly talk about my mental health. And actually, lots of my colleagues have struggled, but we're there for each other. Nothing really beats chocolate, coffee, maybe a walk around the hospital grounds or something to debrief about something that's difficult. But also remembering the person in front of you, in that moment, you are there to help them. And actually, that's when I feel like I'm very good at forgetting everything else. So not how many Instagram notifications I have or anything like that. It's just, this is the person I want to help. And that's what it all boils down to.
Great, thank you. Right, so the Linden Academy Hawthorne class have asked, is your job fun? Now, I know you've talked about some really difficult bits, but are there some fun times too in there?
Yeah, normally for every machine, similar to like a car, you have to turn the car on and it needs to make sure that it's working properly, but it does it. So every morning, if we're running up a linear accelerator, so that's the machine we use, I like to have a different taste of music every day if we did that. So we work together. Sometimes we might have a good chat or a sing song about anything. We've also had patients who maybe don't want to be in the room by themselves, and obviously we have to leave the room because of the level of radiation. But one of my colleagues has sung down the microphone like the two-way intercom to a patient, but it's things like that which you don't really forget. And while I'm not a good singer and I won't put any of you through that, my friend was a good singer, my colleague, but just learning that, that small little bit, or when we've treated younger people, so pediatrics, yeah, just maybe reading them a book over the microphone, something like that. And now I have a 5-month-old son, so I know lots of different books now. So yeah, it can be really fun. And I think, again, it's the teamwork. We're all in it together. We know what's going on and we want to help people. And that's what the NHS is about. Whether it's someone who's cleaning the office to one of the consultants, we're all there together and we all have our part to play to help patients.
Thanks, Naman. Stokely Year 5 would like to know what you'd like to achieve in the future.
Good question. So I've been quite lucky. There is some research that I've been involved in over the past couple of years, and I won quite a few awards last year. So at the moment, I'm on my own, doing my own research into that area, which is basically developing a new tool for healthcare professionals to use to look at different types of skin tone. Hopefully, if it works at the end of this year and beyond, I should be changing and implementing this all across the world. So that's something I'm quite proud of. At the same time, eventually when my son gets older, hopefully push him towards the NHS in some way. But yeah, just everything. For my role as a therapeutic radiographer, there's so much you can do. It's not just about being on the machine. I can go into research as I've done. I can prescribe medications. I can do things like this. I can do charity work. There's so many different things you can do. So yeah, I think, and my problem is I have FOMO, fear of missing out. I want to be part of absolutely everything, and I'm very enthusiastic. So,
so the sky's the limit by the sounds of it.
Yeah.
Okay. Now the Peterborough School. Someone has asked, how long have you worked in the NHS?
So in this role, so as a therapeutic radiographer for 7 years. Before that, I worked in a lab for just under 2 years. So let's say about 9 years in total.
Great. Well, that is the end of our time with you, Naman. Unfortunately, I am so sorry to all of you pupils. We haven't got time for every single question, but hopefully we've answered most of them, and it's given you some inspiration and made you think perhaps about your entry for the Step into the NHS competition. Perhaps you want to make sure that you include what you've learned about being a therapeutic radiographer in there. Naman, thank you so much. We know you're really busy, so we really appreciate you giving your time to us today.
Thanks for the opportunity. Good luck, everyone.
Thanks, Naman. Okay, so Takanayi, we are now going to meet another fabulous person who works in the NHS doing a different job. Hi, Takanayi.
Hi, Abby. How are you?
I'm very well, thank you. How are you doing? And can you also tell us what you are up to?
Yeah, so hello everyone. It's great to be here. My name is Takanayi, or Nai for short, and I am a resident doctor currently working in psychiatry in Oxford. So I'm going to be speaking a bit about what I do on a day-to-day basis, which is basically, taking care of patients in the hospital and, like doing a few bits and bobs around the ward.
Brilliant. Thank you. And thank you to you as well for taking your some time out of your day to come and meet with all of us now. Right. So let's watch your video and please, you know what to expect, everyone. So start thinking about your questions, have your worksheets at the ready, pupils, and let's see what you can learn.
Hi, my name is Dr. Takanayi Ray, and I am a Foundation Year 1 or FY1 in Oxford. This means I am in my first year of medical training after university, and I'm rotating through different specialties and developing my skills. There are different ways to becoming a doctor. The traditional way is to study sciences in school and then go on to complete a medical degree, which can take 5 or 6 years. But for some students who might not meet the traditional entry requirements to study a medical degree, some universities offer foundation courses. This is a transition year in which the student is given education and experiences they might be missing, and then they can then go on to study a full medical degree. As for me, I had a passion for sciences and how lifestyle could change someone's health, and I went on to study biology, chemistry, and maths at A levels, and then I went on to complete my medical degree at the University of Central Lancashire. My morning typically starts at 8 a.m. where I join a handover and get updates about patients who need urgent care and their treatment plans. I then go on a ward round in which the medical team goes around seeing patients, reviewing them, and updating their treatment plans and deciding what kind of care we're going to give them. In the afternoons, I usually go on the ward and clock new patients who have had to come into hospital, and then I also start to do different jobs like ordering scans, taking blood, and prescribing medication. Sometimes unexpected things happen, like patients getting very sick quite quickly or needing special arrangements for them to go home all of a sudden. One thing that might be surprising about a doctor's role is that paperwork is very important and we write a lot of notes. In the evening, I'll usually write up some patient notes, complete any paperwork that needs to be done, and also try and reflect on some interesting cases out of seeing that day. To be a good doctor, you need to have really good communication skills. Sometimes I have to explain things that are hard to understand in a simple way to patients, families, and other healthcare professionals. Teamwork is also very important as we work quite closely with other healthcare professionals such as nurses, pharmacists, and different kinds of therapists to provide the best possible care for our patients. Leadership is also really important because you need to be able to delegate tasks and lead things like ward rounds. In order to take good care of your patients, I personally think you need to be kind, a good listener, and understanding. And you also need to be resilient because medicine can be emotionally challenging at times. No 2 days are the same as a doctor, and something exciting is always around the corner, so I would definitely recommend it as a career. If you're passionate about science, medicine, working in a team, and helping people, a career like medicine and being a doctor could be for you.
Great stuff. Thank you for doing that video for us, Takanayi.
Pleasure.
That's great. So you talked about the kind of the variety in your job, always something exciting around the corner. What kind of, what is the most interesting part of your day potentially?
I think probably the most interesting part of my day will be in the morning when we're doing the handover. And I know in the video it looked boring because I was just typing on a computer. But if you were to imagine it, right, you work in a ward where you're taking care of like 10 patients and you've done everything for the day, and then you go home, sleep, and you know that there's been like 12 hours you haven't been there. So it's quite exciting to come in the morning and get all the updates about how the patients are doing, how they slept, if they slept well, if they're eating and things like that. So I think, yeah, the handover is always, like the time where something interesting could pop up.
Yeah, great. Okay. So I can see lots of questions in the chat about what inspired you to become a doctor. You mentioned it very briefly in your video, but do you think you could expand a little bit on that?
Yeah, of course I can. So what inspired me to become a doctor? I've been asked this so many times. So my answers changed over time slightly. But I think if I can think back to like the first sort of like thing that inspired me, I don't really remember what day it was, but I just I was about 9, 10, 11 years old, and I was just always excited about different things, adventurous, and I found science. So I found biology, I found chemistry, and I immediately got hooked. And kind of thinking about, oh, what kind of career can I do if I like science? And I started seeing, people doing different things in science, and I met a few doctors. And for some reason, I always just used to be a bit more interested in what they did. I think it's because probably I like biology more than anything. And so kind of started growing up and seeing how, oh, people do get sick when they're older. My grandma's in hospital because she's unwell. I had to go to see my GP because I had a flu. But then these people used to fix it. So it was like, okay, so you can do something about these things. And I think as soon as I joined the two dots that, if you're scientific, there's a thing called medicine and you can be a doctor and, save lives and help out. I think because of the amount of, people I care about who've, seen doctors and gone treatment, myself included, I've always just wanted to join the force and help out as well.
Brilliant. Great answer. Thank you. Right. So we're going to take some more questions in a minute from the chat. And as always, there are loads of great questions in there. So thank you, everyone. But let's just go back to that question from Riverdale Primary School. And same question to you, Takanayi, if you could, please.
Sure.
So what's the best part?
Ooh. I think the best part of my job, or personally, is the fact that you get to do procedures and, sort of like examinations. What that means is sort of like, it goes from small things like, taking blood from someone, but at the same time, you could end up, doing like a small procedure. That's like sort of like a minor surgery, trying to get like, a tube into someone's vein or something for like an operation. So kind of like doing those like little skills or like doing scans on people, I think is probably the best part because you see people do it on TV and you see people do it all the time and it's like, okay, that looks interesting, but like learning how to do it and actually realizing, oh, I can do this as well, like if you're not squeamish, of course, like, cutting and, like being precise about your work and, taking care of the side, making sure it's all clean and like that, part of like doing procedures, like scans, taking blood and things like that is probably like the most exciting part of my job.
Great stuff. Thank you. Right, we've got a couple more minutes, Takanayi, so let's see if we can get through some more questions. Spencer wants to know, can it be scary at times?
Yeah, I mean, of course, I think especially when you're starting out. So I'm still in my first year, remember. I think there can be times when, you're faced with, serious situations, people are unwell, and it can be scary. But I think that's the great thing about working in the NHS because you never really work alone and you're in a team. So there have been times when it was scary. What did I do about those times? I relied on my team, and most of the time it's a good outcome.
That's brilliant. And you and Naman have mentioned teams, and that's so important, isn't it? Teamwork. Great.
100%.
Right, we have a question here from Joanne who says, what areas can you specialize in when training? That's a great question.
That's a lovely question. I love answering that because you can specialize in anything that has to do with medicine. It could be hair, it could be face, it could be ears, it could be hearts, it could be quite a few things. It's why I like doing medicine and being a doctor because especially where I am now, where I'm still training, as you saw earlier, I've rotated already through general medicine. I'm doing psychiatry now and about to do surgery. And I'll get to a stage where I can just pick one of them I want to focus on for the rest of my career. And yeah, so you can specialize in quite a few things.
Okay. Right. What's the worst part of being a doctor? Because every job has its challenges, doesn't it, as well?
Yeah. I think, if I'm being completely honest, I can't say anything is the worst part. I can tell you what probably some of the harder things are. And yeah, I'll let you know. So I think obviously studying to become a doctor takes, you have to do 5 years of university as opposed to maybe 3 or 4 in other degrees. So, it does take quite a while to get through medical school, and it is difficult, but it's an enjoyable process. And like I said, if you ask me, it'll be something I'll say, oh, that was the hardest part, but it wasn't the worst part because it wasn't that bad.
Okay, great answer. I like that. So I think we've got time for one more question. And let me, is the questions are moving around all the time. So I'm trying to find one. Someone has asked actually about surgery, whether you've done surgery, done an operation.
Yes, it's an interesting story. So when you're like a junior like I am, obviously you're not going to be the lead surgeon because you're not that experienced. But for any surgeon to do surgery, they need an assistant. So you get to like probably make some incisions. We do the suturing afterwards, and like we're helping out to like hold things, and they might even ask you sometimes to use. So this is one of my most exciting ones. I was asked to plug a hole that was bleeding whilst the surgeon was trying to sort it out. So yeah, you do get to do some surgery if you're keen and things like that. So yeah, it can get really fun actually.
Brilliant. Okay, so we are out of time again for questions. So many good ones. I've just seen one come in about leeches as well, actually. And I'm sorry we haven't got time for that one. Thank you, everyone, so much for all your brilliant questions. You are obviously really thinking about this and learning, so it's great. Takanayi, thank you again for your time and for sharing your experiences and doing that video for us. Okay, so that is the end of our career spotlight number two. Yes, I think it was number 2. Thank you all so much for joining us. We hope you've enjoyed it. We hope that you have got some inspiration for your competition entry. I've seen on social media that some people have already started their competition entries today, and that's so good to see. So please keep the social media posts coming with hashtag Step Into the NHS. We have got one more career spotlight for you today, and that is at 2:30, and you're going to be meeting 2 more people from the NHS, and we're going to be playing a game called 2 Truths, 1 Myth. So we really hope you can join us for that last session of the day. If you've got questions about the competition or about careers in the NHS, then there are details in the chat and on the slide, and you can get in touch with us. Same Teams link to use for the last session, so you just need to rejoin this. Thank you all again, and we will see you, I hope, at 2:30.